Chapter 19. The Eye. 19.1. Complete the table with words from be, opposite, and related forms. Verb: accommodate, constrict, converge, dilated, drop, oscillate, react. Noun: accommodation, constriction, convergence, dilation, dilatation, oxytocin, reaction. Adjective: constricted, dilated, dropping. 19.2. Match the picture with the conditions. Look at B opposite to help you. Picture 1 is E, skinned. Picture 2 is C, irregular pupil. Picture 3 is B, dilated pupils. Picture 4 is F, constricted pupils. Picture 5 is D, cataract. Picture 6 is A, dropping of lids. 19.3. Complete the extract from a textbook. Look at C opposite to help you. Retinoscopy. Examine the retina with an ophthalmoscope. It's possible with the pupil dilated to obtain the maximum view. Look for papilledema and for helmet-shaped hemorrhages and cotton wool exudates. Assess the state of the arteries and note the presence of any narrowing as well as nipping at arteriovenous crossing. Chapter 20. The gastrointestinal system. 20.1. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 degrees, pulse 100 m, blood pressure 110/80 mmHg. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized epidermis, which was most marked in the right lower quadrant and was associated with guardian but not rigidity. There was no rebound epidermis and no masses were felt. Vowel sounds were reduced. 20.2. Match the description of the stools with the condition most likely to cause them. Using your medical knowledge, look at B opposite to help you. Type of stools: condition: loose, bloody, ulcerative colitis; loose, pale, bulky; celiac disease; clay-colored, obstructive jaundice; black tarry; gastric ulcer; small, hard; irritable bowel syndrome; clear, watery with mucus; cholera. 20.3. Match the features to the doctor's questions. Look at B opposite to help you. Blood: have you passed black stools? Bowel habit: how often do you open your bowels? Change in bowel habit: are you going to the toilet more often than normal? Bulk: is the size or the amount of the stools normal? Color: what's about the appearance of the stools? Consistency: are the motions hard or loose? Offensiveness: do the motions have an unusual smell? Chapter 21. 21.1. Write a simple English phrase or each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy: surgical removal of the uterus. Menorrhagia: prolonged menstrual period. Salpingitis: fallopian tube infection. Cervical biopsy: biopsy of the neck of the bone. 21.2. Read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Menarche, 12 years. Menstrual cycle, 4528. LMP 152. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little white discharge. 21.3. Now write the question that the doctor asked. Look at C opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, how long do the periods last usually? LMP, when is your last period? Menorrhagia, will you say they are light or heavy? Dysmenorrhea, do you get period pain? Discharge, is there any discharge between the periods? 21.4. Complete the case report. One word is needed twice. Look at B and C opposite to help you. Case 15. A 45 years old woman has been having prolonged periods lasting for 8 days, with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a copper coil was fitted. She had had a normal pregnancy when she was 25. Chapter 22. The Heart and Circulation 1. 22.1. Complete the conversation based on the case history and be opposite. Doctor, what seems to be the problem? Patients, I've been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. 2 words can be used twice. Add fibrillation, atrial rest, cardiac output, heart failure, on effort, pitting, oedema, premature beats. 22.3. Write the words a patient will use to describe the symptom below. Look at A, B, and C opposite to help you. Dyspnea, shortness of breath. Arrhythmia, palpitations. Orthopnea, breathless when lie flat. Oedema, swelling. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60 years old woman attended her GPS surgery complaining of breathlessness on exercise. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes of fast palpitation which lasted 20 and 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the ends of the days. This disappeared overnight. Chapter 23. The Heart and Circulation 2. 23.1. Complete the table with words from A opposite. Birth, auscultate, examine, inspect, palpate, percuss. Noun. Auscultation, examination, inspection, palpitation, percussion. 23.2. Put the step for examining the heart and circulation in order, according to the 4-stage system. Look at A opposite to help you. The 1 is look for clubbing. The 2, feel the radial pulse. 3, locate the apex beat. 4, note any trills. 5, measure the heart size. And 6, are there any murmurs? 23.3. A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was pyrexial with a temperature of 38.5. She was short or of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130/80 and her BBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present and there was no central cyanosis. Her apex disc was displaced to the anterior axillary line visible in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pain systolic and mid-diastolic murmurs. Heart beat at the apex. When she was examined some hours later, there was a harsh pericardial friction roof all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. This is all of my part, and thanks for the attention.